Breast cancer is one of the most common cancers affecting women in Zambia. Hi and welcome to the Cancer Smart Youth podcast show. I am your host, Ida. Now today we're talking about breast cancer because breast cancer has been on the rise of late and it's affecting many women, including young women. And today on the podcast, I have someone who is a breast cancer survivor because she was just diagnosed a year ago and she's a mother of one. Her name is Patience. Hi, Patience.
Hi, Haida.
Welcome to the podcast today.
Thank you so much.
All right, so I'm happy you're here. You're looking fabulous, all nice, and I love it.
Thank you.
Okay, so let's get started, Patience. Your breast cancer journey. Yeah. Number one, how did you discover it?
Okay, so how it started, I didn't know actually that I had breast cancer because to me it was just this small lump, which was harmless to me at that time. So I continued with my life like that. So I never even mentioned it anyway to anyone that. So not until it was like maybe after 4 months it was still there. And then I mentioned it to my husband because we are not together by that time. I was in a different district. He was here in Lusaka. So we were just talking on phone. Okay. So I was like, I think...
Oh, but sorry, you were still married?
Yes, but married.
Because of work?
Because of work, yes. He was here in Lusaka. Yes, I was in Eastern Province. So I was like, this thing, I've noticed there's a lump, there's a lump in my breast and it's not going away. So I was like, okay, when you come to Lusaka, we'll have it checked. That's what he told me. Oh, okay. Does it pain? No, it doesn't. And is it growing in size? No, it was just like that. So after mentioning that, of course, I continued thinking it is just something that can go away with time. Yeah. So time passed. I came to Lusaka. After during holidays, I came to Lusaka, and then Happy was like, okay, can I check it? Let me examine your breast. And so we started palpating, and he noticed to say, okay, for sure there's a lump. So that's how we suggested to say, okay, we need to go to breast clinic at Levy. So we made an appointment. We went to the hospital actually, and then we were told, okay, for breast clinic it's on a Wednesday, and we went on a Monday. And that same Monday, the following Tuesday, I had to travel back for work.
Oh.
So that's how we did not continue with the checkups that time. So I went back for work. I stayed there again for another 3 months. So when I came back in April last year, that's when Happy was like on me to say, we have to check this now. Whether you like it or not. I was like, no, but it doesn't pain. Like, no, it doesn't mean if it's not giving you issue, then it is harmless. Let's have it checked. So that's how of course, we went to Levy again, and they gave us an appointment to say, okay, you should come next week when it is a breast clinic. That's when you'll find the breast surgeon. So, okay, so we went to Levy, and then they suggested that we do a biopsy. After we did the scan confirmed to say, okay, for sure there's a lump. So they suggested for us to do a biopsy. So we went to UTH, did the biopsy, started waiting for results. And for the results, it took about 3 weeks for the results to be ready. So when the results came, my husband was called to say, okay, the results came, but it looks some kind of suspicious. So because we did a thin biopsy at first. So they said we do a core biopsy, just to be sure. So for me at that particular time, it wasn't even clicking in my mind to say it could be something that would be cancerous or something. So we waited again. We had to go and do now core biopsy at Levy. So we went to Levy, booked for core biopsy, which was done. We took the samples for testing, and it took again another 3 weeks for the results to come out. So when the results come out, of course, my husband received them through the phone. So this is him calling me now to say we need to talk about something. Oh, okay.
What is it?
Yeah, so to me maybe it's just one of those my family things, and but I looked at him there was just this seriousness which is never on his face. Yeah, it's like, what is it? But it never crossed my mind to say maybe it's because of the result or something. So it's like, okay, my wife, we need to talk. Okay, so he started by encouraging me, started with the scriptures, of course, and assuring me of how much he loves me.
I'm confused. What is it trying to say?
Yeah, so this is a loving man already. Anyway, so what's this? So I said, okay, the results are out. Oh, okay. What are you saying? So the results are out, but the good part is that there's treatment. Okay, what are you saying? So I said, okay, my wife, the results are not good. The mass has tested positive to malignancy. I said, oh, what's that? Meaning the tumor was cancerous in the breast. So at the moment I had to hold myself to say, okay, my husband is not a joking type of a person. So what are you saying? I was like, what are you saying? He's saying there's breast cancer in your breast. I'm like, are you joking? But again, I answered myself to say, you don't joke, so how come? He told me, calm down. Trust me, I couldn't calm down. Because it is never something that I imagine to say, however, I would hear anything to do with cancer on me. Yeah, because it is something that I never heard of, like maybe my family members. So it's like, all I know is that cancer is not a good disease. So I had to break down. I couldn't hold myself. It was a bad moment for us, actually. Of course, my husband was trying to be strong, but because of how I broke down, he also broke down with me. But later on, he held my hand to say, it is well, babe, it is fine. Why? Because there's treatment. That's what he told me, there's treatment. It's like, what do you mean there's treatment? Because they say cancer is deadly. Yes, it is, but patience, it is not bad. Actually, we went to the hospital early. We didn't wait, so it's not bad. So, whoosh, of course, like from that time, my life changed. I couldn't keep a moment without thinking about me having cancer in my body. So that's how he said, okay, since the results are out, we need to go to the hospital as soon as possible, because that was on a Friday, and we went to the hospital on a Monday. And for me, just waiting from Friday to Monday, it was a long time.
It was the longest weekend.
Yes, it was the longest weekend. I just wanted us to go to the hospital. They tell me what's next. How do they remove this cancer from my body? How do I continue with my life? Because my life was, it was at peak. I was at the best of myself before that. So we went to the hospital, of course, on a Monday. We showed the doctor the results. And he said, okay, they checked again, and he said, it's good that it doesn't even, it's not that bad, according to what he said. It is in early stages.
What stage was it?
It was stage 2.
Okay.
Yeah, and the tumor, he told me that the tumor is very small, patients. It's really, really small. So I was like, okay, so then what's next with my life then? What's next? How do I give up? So even at that point, I was thinking maybe they would just say, okay, we'll give you this medicine and you take it and the lump will go away. But no. So the oncologist started explaining the treatment plan for us to say, okay, so the treatment plan for breast cancer is, to start with, it's up to you to choose, because your tumor was small. So meaning you can start with surgery first, either lumpectomy or mastectomy. He explained, I had to understand what was mastectomy, what was lumpectomy. He explained to us. And then, of course, possibly after that, we'll we'll refer you to CDH because it is a cancer case. We don't mean you have to go to CDH to continue with the treatment there. Of course, there's chemotherapy. I had to ask what's chemo. He explained to us what chemotherapy was, as well as talked about radiation, also talked about immunotherapy. He did all that because I had to ask to understand exactly what I was dealing with at that particular time. So after I explained about the whole treatment plan, I had to ask for a moment to understand on my own what it was exactly. So we went back home, and my husband, now with the help of my husband, he started explaining to me exactly how it is done, the outcome. So we had to talk about lumpectomy, to talk about mastectomy. Yeah, so we agreed to say mastectomy is the best actually.
Okay, and sorry to cut you, but is your husband in the medical field?
Yes,
okay.
He is.
Okay.
So he's the one who even told me to say, of course he explained to me as a patient, not as a husband. That's one good thing about him when he's dealing with issues to do with medical. He doesn't talk to me as a wife, he talks to me as a patient to say, okay, these are the options now. As a patient, choose now. Which one do you think? So this is me saying, okay, I think according to what you've explained, I think mastectomy is good because I wouldn't want again, if anything, I go back to go through the same procedures again. So it's better I do with it once and for all, if the outcome will be that good. And then I had to ask him, how about you? How would you, since it is your wife, how would you want this to go? What's your opinion on the status of your wife concerning having a mastectomy? And he just said, life is more important than boobs.
Life is more important than boobs.
Yeah,
you get that.
That's what he told me. Life is more important than boobs, my wife. I would rather have you without boobs than you not being there at all.
Yeah, and just for the sake of people that might not know what mastectomy is, would you like to explain?
Okay, so mastectomy is where they remove the whole breast. They cut off the whole breast. Yes. Okay. So I resorted for mastectomy because they told me to say that my tumor was small and the chances of me having clear margins were high. So that's why I suggested, okay, then mastectomy is the way to go for me.
Okay.
Yeah.
Okay, I'm so glad that you have a supportive husband, someone who encouraged you to go for screening, got the results, found a better way of translating the news to you, which is so rare. And Habi, we love you from Zambia
so
Cancer
much.
Society.
So much, really.
And the Cancer Smart Youth, we love you. And really, this is the support that we all need.
Yeah.
Every woman needs a supportive partner, and every man needs a supportive partner as well. It goes both ways for sure, because we have seen instances where a man would say, I would never have a woman without boobs, because what am I going to be touching?
Exactly.
And we have experienced and witnessed divorce cases. But God bless your husband. Please tell him he should be the next guest on our show, so that he encourages other men out there.
Definitely, I'm sure I'll be glad to do that.
Okay, so now you are told all this in a short period of time. You are diagnosed with breast cancer. Lucky enough, it was in early stages, and one of your treatment options is to have your breast removed. How do you receive that? Like having a part of you taken away.
Trust me, this is me thinking, even the time that I was saying, okay, we'll do a mastectomy, to me I was thinking it's just something that we'll do to be done and I'll have my life back. But now that time came. Of course, I had all this anxiety before surgery.
It's normal.
Yeah, I was so scared. But after surgery, of course, I had bandages on, so it was okay. So now, after the removal of the bandages, this is me now. just that fear of not having a body part.
Reality hits.
It hit me so bad. It depressed me actually, more than the cancer news itself. But losing a breast was so hard for me because I couldn't even want to see myself in the mirror. Even just for me, having my hand accidentally touched there and finding there's nothing, it was scaring me. I was so scared to look at myself. But thank goodness, how did I overcome that? I have a pink sister, Hope Mlenga. I gave her flowers, of course. She came through for me and my family at the time after the diagnosis, the way my family received it. But when she came, actually, she talked to us. Okay, she encouraged, of course, my mother, my sisters. Of course, she had a word with us, and it sounded like it was a journey that we can walk together. So even at that time when I told her to say, because she had gone through the same, so I told her to say, I'm not even ready to look at myself. I am not ready. So no, Patience, you have to do it. And I said, no, I'm not ready. I had to cry to say, no, you just have to look at yourself. And I said, no. So she helped me, actually. She showed me a scar. So after seeing a scar, of course I got scared because is this how I'm looking like? Okay, but I had the courage also to look at myself. And after she left the following day, of course my husband saw how much it was breaking me, like even him just to say, can I have a look at your scar? Is it looking, how is it healing? The way I was responding to him, of course, he knew that I wasn't comfortable with it. But he told me to say, nothing has changed. You're still as beautiful as you. The same way someone is able to lose their leg through accidents, okay? But you take it as it is a body part which was taking away your life and you have it removed. Feel that way. It is not easy. So he helped me, okay, can we have a look at it together in the mirror? And we did. Can you touch? I touched it. How would you feel? Feel bad. I was breaking until I had to. We laughed it, and I remember. I remember even making jokes out of it and said, "Babe, how are you going to be waking up with a woman with one breast for the rest of your life?" And just like I'll be looking at the other one, I'll be looking at the other one. And also my son encouraged me.
How old is your son?
He's 6 years.
He's 6?
Yes.
Oh, okay. How did you break the news to your son?
Wow.
Did he understand what cancer is at such a young age?
With time he came to, at that time he did not understand. And we didn't know how much it was affecting him. Just seeing me down, seeing me depressed, it was affecting without us realizing. So of course we had called for a family meeting with the babies in the house to say, okay, this is what is happening. Mommy has got cancer, and she has got breast cancer actually. So of course we need to go for surgery and have the breast removed. And my son was like, yeah, you know what, Mommy, so meaning your breast has got bacteria, right? So if something has got bacteria, it's better to have it removed.
Luckily, cancer was caught in the early stages. Big thanks to her husband, who encouraged her to go for screening, who helped her through the journey, who has been helping her through the journey, because Patience is still on treatment. So these are the conversations that we have on the Cancer Smart Youth podcast show. If you are a cancer patient, a survivor, and you just want to share your experience about anything cancer, anything health, feel free to follow us on all our social media platforms at Zambian Cancer Society: Instagram, TikTok, Facebook, LinkedIn. You should also subscribe to our YouTube channel so that you don't miss an episode. Contact us on 0976 659914.